doctors, now about pineal gland. So pineal gland is also called as epiphysis and was initially described as main controlling center in the brain that can influence many CNS function. But till date, function of pineal gland are not that clear. We are not very clear about pineal gland except the role of melatonin secretion and control of light-dark cycle. So melatonin is synthesized from which amino acid? It is synthesized from tryptamine, and its secretion exhibit a remarkable diurnal variation. You can see in the diagram, the secretion is maximum in the night, especially between 11 p.m. to 7 a.m. It is called as hormone of darkness. So after 11 p.m. up to 7 a.m. in the morning, it is maximum in your blood circulation. So the melatonin synchronized with a light dark cycle that is controlled by inputs from what? Retino hypothalamic pathway which project to suprachiasmatic nucleus. See, whatever light is falling on the retina, that will go to the optic chiasma, and above the optic chiasma there is suprachiasmatic nucleus. So by this your suprachiasmatic nucleus is able to maintain as a biological clock. It is called as biological clock now. How? So this is called as external clue. So sunlight is called as external clue. And then the fiber from this suprachiasmatic nucleus, this is going to terminate in the intermediolateral gray horn of thoracic spinal cord that in turn project to the superior cervical ganglion, from where fiber originate to end in the pineal gland. So can you see, from retina, it goes to retinohypothalamic pathway, then IML of the spinal cord, then superior cervical ganglion, then pineal gland, then melatonin is released. So suprachiasmatic nucleus along with the melatonin is able to maintain your biological clock. But recently one thing is known now, not only external clue, the sunlight, which is responsible for this maintenance, there are internal clues also in your own body. Even if you are in a dark room, then too your biological rhythm is maintained. Those are called as internal clue in comparison to the sunlight, which is called as external clue. So what is the function of this melatonin? So melatonin secreted from the pineal has so many functions. Like for example, the melatonin from the pineal has a definite diurnal pattern. You know this. This diurnal change in the melatonin is believed to coordinate with the endocrinal response of the body with the light-dark cycle in the environment. Some hormones are more in the morning, some are more in the evening. For example, ACTH is maximum in the morning after you wake up and minimum at the midnight. So how these hormones and your body come to understand that this is morning, this is night? So how this is going on? With the help of this melatonin. Every cell of your body knows what is exact time. They don't have to watch their, we have always watch, we have to see every time. But your body cells are more intelligent than we. They know how? By melatonin. Have you noticed that if you are sleeping and you know that you have to wake up at 6 a.m., suddenly at 6 a.m. your eyes open like this? There is an internal mechanism going on. A lot of work has to be done on this. It is called as chronomedicine. I am from King George Medical College, and one of my professor, now he is head of department there in King George, Dr. Narsingh Verma. He has done a lot of, remarkable work on chronomedicine, the fluctuation of BP and a lot of work. And he also has given so many degrees in England also for this work. So I mean to say that a lot of work has to be done. This is a field which have to be explored. So the first function of melatonin is this cycle, the diurnal pattern. And also melatonin secreted from the pineal gland inhibit gonadal function. See, it is believed that pineal secretion inhibit the onset of puberty. I have told you in the previous class also that as a child is born, why does not he attain the puberty? Who is inhibiting that? And then I have told you that gonadotropin releasing hormone, the release is continuous. And whenever release of GnRH is continuous, this is going to inhibit FSH and LH. And this continuous release is, facilitated by melatonin. And when puberty achieve, kiss peptide come and make that release pulsatile, and that stimulate FSH, LH, puberty come. So till the age of puberty, who is inhibiting this? It is melatonin. Therefore, the regression of pineal gland stimulate the beginning of pubertal change. Such a beautiful coordination you can see. It has been observed sometime that precocious puberty and sexual precocity are associated with the pineal abnormalities. You must have seen sometimes their patient, the person is having precocious puberty, puberty at the early age. It has something to do with the pineal gland abnormalities. I've told you a lot of work have to be done on this gland. Okay. In the lower animal, it has been seen that melatonin also influences the activity of melanophores and therefore they control skin color. However, such function in human appear to be uncertain. It is not very much clear, but of course in the lower animal. So till date only this much is known. So you are going to become doctors. Okay, you are the budding doctor. So I request every one of you to do a lot of research on this melatonin pineal gland. You are going to explore a lot of things. In the mythology, if you see, there's a lot of importance is given to pineal gland during meditation and all. I don't know what is the reality, but a lot of research has to be done. Thank you.